Hey everyone, it's the top of the hour. Welcome to our webinar. Marty, can you click on the next slide? Welcome to our webinar, Health Literacy, Component of Risk and Safety Communication. My name is Scarlett Juarez, and I'll be moderating today. Thank you for joining us today. We welcome our speakers, Ben Richmond, Marty Lindsay, and Don Quintanar. I will be introducing them shortly. Before we begin, I want to cover just a few housekeeping items. Make sure you connect to audio using your computer speakers. All attendee microphones will be muted for the duration of the webinar, but please feel free to comment in the chat box. And please use the Q&A box on the bottom of your screen to ask questions to the speakers. They will answer the questions at the end of the presentation. If you're not familiar with the Q&A, it is found at the bottom of your screen. To bring it up, simply hover near the bottom of your screen and you'll see a Q&A symbol. If you click on it, a Q&A box will pop up and you can send your questions through there. If you're having any technical issues, please send an email directly to support@healthliteracysolutions.org and our technical support team will try to work it out for you. Please note that this webinar will be recorded and posted in the Health Literacy Solutions Center webinar archives. If you are requesting CEUs following the webinar, you will receive an email containing a link to a brief online evaluation. You must submit that eval in order for you to receive your CE certificate. Our speakers will be using Menti for this webinar. So please go to www.menti.com. You could use it through a phone or a tablet. It works well using those devices and input code 9871879. I will also be placing that in the chat box. But if you could open your browser, go to the other device and start doing that now. So by the time the speakers go through their presentation and ask questions, you guys are ready. With that, I want to introduce our first speaker, Marty Lindsay. Marty Lindsay was appointed Community Engagement Director in 2002. Her work focuses on environmental health promotion with tribal communities. Her research focuses on environmental health literacy, risk and safety communication and education. Her findings from her dissertation did not support the conventional wisdom that people comprehend materials written at a lower reading level, rather that they need to be empowered and motivated to be interested in the content. Other research findings indicate that participants who understand the science choose the simple materials with clear images. Her current research focuses on best practices for empowering Native students to pursue higher education, environmental health literacy, and risk and safety communication. Our next speaker, Ben Richmond, is an assistant director of the Southwest Environmental Health Sciences Center's Community Engagement Core. He has worked on a variety of projects and programs related to environmental health literacy, risk communication, and communicating complex environmental health research to the public. Specifically, these research projects aim to learn the ways in which individuals understand how the environment affects their health, as well as how individuals best receive information related to the environmental health. With that, I would like to pass it on, turn it over to Marty, who will present Daniel and go on with the presentation.
Morning, everybody. Thank you very much for that nice introduction. We're very happy to be here, and we're going to be talking about research that's been conducted over the last 4 or 5 years in conjunction with Dan Kintanar, who will present some information about how it came to be and some basic information about risk communication. We've been working together for over 20 years, communicating information about water quality to the public in southern Arizona. And Dan has been instrumental in this research. He is the project manager for the City of Tucson Water Department and has been with them for over 20 years. He has experience developing innovative research programs, process improvement strategies, and spearheading new technology and information applications to improve emergency response management, water quality management, customer relationships, and organizational development. He chairs the Research Oversight Committee and the technological team for the utility. So we're very happy that he has joined us for part of this presentation. So what are we talking about? Well, we're talking about a project that's called Water Talks. It was developed out of some environmental health research, environmental health literacy research that we conducted under funding from the National Institute of Environmental Health Sciences. And specifically, this project was aimed to develop a protocol and training for developing messages and materials concerning environmental hazards, specifically water quality problems. Our goal is for people to be able to act upon risk and safety messages to protect themselves, their families, and their communities. So the protocol, which we'll go into a little bit more in depth a little later, has these components. It starts with why communicating and goes over what is the risk, how to protect yourself, who's the audience, where to put the information, when to communicate, who can review, how to implement, evaluate, and revise. So it's considered a long-term protocol, not just getting the messages created, but also how to keep the messages out in the public. In addition, we developed a Google Classroom, which we will invite you to, where more in-depth information is imparted about risk and safety communication in the context of environmental health literacy. So first, we'd like to know what your profession is. Please go to the Mentimeter, menti.com, and enter in the code 9871-8729 and answer the first question. What is your profession? It will help us be able to make sure that we are providing the right information to you. So it looks like we have a variety of professions, but they all seem to revolve around health education, health and engagement with community members, a couple in worksite, a few scientists, policy people. So I think this information will be useful to all of you. It's important to think about how we communicate risk and look at it in the context of health literacy. So I've been studying health literacy since 2002, and it's been massively interesting to me to look at the ways people learn and understand science. I'm going to close the voting now, and I will continue with the presentation. Thank you very much. So our goals are to be able, for you to be able to describe health literacy as an essential component of risk communication. There's 12 features of environmental health literacy, which we will discuss, 6 that revolve around knowledge and 6 that revolve around skills. We want to introduce how you can understand the health literacy and literacy levels of your audiences and apply this understanding to developing new messages and materials, and how to use the issue of risk perception in discussing risk communication. I think we've all been really exposed to the issue of risk perception over the last year and plus when we look at COVID and people either not understanding that there's a risk associated or being overly concerned. So finally, we'll talk about the importance of plain language. I think some of this will be new to some people. Others may be a refresher. So the foundation, environmental health literacy and risk communication. So when we think about health literacy, we think of plain literacy, understanding how to read, and how to take information out of text, specifically health information. And oftentimes this is information regarding a health condition or a treatment. And what we think of as environmental health literacy moves into how people can prevent problems to their health. And this requires them to understand something of science, biology, chemistry, and even physics, because we need to understand how contaminants move through the environment. So going back to the COVID example, we first thought it might be by touch, but now we know that it's mostly by air, that the COVID virus moves through the environment. In addition, people need to understand how to find and use information in a way that is impactful of their personal health and their family's health. Then we need to understand basic communication skills, risk perception, numeracy. So understanding numbers. And I often see people who are trying to communicate about COVID who are using numeracy in ways that might not be understandable by the general public. And finally, to really echo in on the issue of plain language. So looking at basic literacy, we can see that we're worried about Arizona, where 70% of the population has above basic literacy, but much of the country does much better than Arizona does, and a few areas do worse. So according to the CDC, found that adults who self-report the worst health outcomes also have limited literacy, limited numeracy, and limited health literacy skills. I know that I'm talking to the converted here, so I won't go into that in any more detail. If by some chance you don't know about this, the CDC covers this really well. However, this map, health literacy map, .unc.edu has maps of how basic and below basic literacy is distributed throughout states. It also has the quartiles, the more refined versions, but we have used this map to understand what is going on in Pima County, where we work, and in Tucson, which is this area where the right here, where Tucson, where the areas in red are the areas that have been mostly, that find themselves mostly in the areas where have been contaminated by TCE. This is one of the quartile maps for Arizona, and you can see that the highest quartile in the dark green is mostly in the Phoenix area and in the Tucson area. But there's still large groups of people who are finding themselves in the lower two quartiles, the red and the orange. So this means that people really have a hard time understanding the science, being able to read even newspaper articles. Newspaper articles are written at above basic levels, more in the quartile 3 range. So what state do you reside in? So it looks like we're all over the United States. So some of the research that we're going to be talking about really queried people throughout the United States. Thank you very much for participating. It really helps me stay, in this COVID era, it's hard to figure out how to talk to a community or participants so it's nice to use this Mentimeter. Okay, so now I'm going to tell you about our environmental health literacy research, which really defined for us the knowledge and skill items that comprise environmental health literacy at the essential levels, being able to really understand how the environment impacts our health. And this was a mixed methods research where we did interviews with 24 environmental health professionals, people in water quality, people in teachers, environmental quality professionals, and also environmental health professionals. And it came to our understanding that over 70%, and then we did a survey across the nation of 275 participants. And it was pretty evenly distributed across the nation. And 70% of the respondents said that there's a connection. People need to know that there's a connection between the environment and health. And that was really the top one. But then how those agents get into the body, how to find and use information about those harmful agents, ways to avoid environmental agents, and how to identify reliable information, as well as that research takes a long time, which we often find in the COVID example that people go, well, why did you say before we shouldn't wear masks? Now you're saying we must wear masks. This goes back to people needing to understand the nature of research and how long it takes. So then as far as skills go, being able to find information, convey concerns in and actually have a conversation about concerns. And we discovered this very much in the TCE contamination in Tucson, where people have a particular point of view, and it's very difficult to have a conversation about that information that they're relying upon. The other skills are to identify hazards, judge the reliability of information, and find more information in their own home. So it's really important to look at both knowledge and skills when we're talking about how the environment impacts health. And included in this is, of course, science literacy, the ability to understand how the science operates. And one of the things that we know from health literacy is that older people have a little bit more difficulty with health literacy and also in science literacy. Information literacy is the ability to identify, find, evaluate, apply information and acknowledge where you're getting your information from and whether or not it's reliable. Numeracy, really ability to access, use, and interpret. That, I think that word interpret is almost most important, because if people can interpret numbers, they are better able to understand how the environment impacts their health. Finally, our basic communication skills. And when we've done these studies or looked in the literature, listening is so important. And it's amazing how many people, when they listen, are really trying to figure out what they're going to say next. They're not really listening. They're not watching for the nonverbal communication. They're not asking the questions that clarify what they're hearing. They often, if what they're hearing is not what they want to hear, they respond better to friendliness than they do. And oftentimes, if they're not perceiving that person to be friendly, they simply will not listen. And so friendliness includes empathy, open-mindedness, respect, feedback, and for us in health communication, needing to pick the right medium for the right audience. So I would like you now to rank what you think are the most important communication skills. You can just move these around. They're intentionally alphabetical, so as not to set anybody's preference. We'll give it a few more seconds. So we got about half of the participants involved, and we seem to have had an ongoing conflict between listening and clarity and concision. So, and at the bottom, it seemed like feedback kept coming. It was friendliness, confidence, and feedback that kept vying for the bottoms, the 8th, 9th, and 10th position. So it's important. I think that this group really does understand good communication. So let's talk about risk perception. You know, not all of us perceive risk in the same way. And that is impacted partially by our feelings, our instinctive or intuitive reactions. And I thought, you know, early on, when Dr. Fauci was really, he was the one that people most respected. And maybe that was partially because of his position, but I think it was also because of the way he spoke. He spoke to people's feelings and he didn't negate them. And the other part of risk perception is the ability to analyze, reason, and deliberate or on their thinking. And this is something that I think we try to teach in school, but I don't know that we've done as good of a job with this as we could or need to. So risk as feelings. See, in this particular diagram, we see that people anticipate outcomes. So in the beginning, I remember the day that I had to close up my office and go home, I thought, oh, we're going to be gone for 2 or 3 weeks. Well, it quickly, and that was my subjective kind of, you know, okay, SARS, you know, bird flu, other things. So I didn't really think it was all that going to be all that big of a deal. But then as I watch the news and I am kind of, because I'm in public health, I kind of have a bent in that direction. I have a daughter who's a doctor. And so maybe I had a little bit more cognitive evaluation of what was going on earlier. And I remember going grocery shopping and putting in all my groceries. But I started to feel more worried, which led me to adopt a mask, adopt staying home. And now I still continue to stay at home. Because of my age, I think I'm more at risk. So the other part of risk communication is the issue of outrage. People get outraged when their children get sick, when they feel like there's something going on that's not being communicated. I really like the clarity issue in the previous slides where clarity really can reduce the level of outrage. and you have to kind of expect that there's going to be a level of outrage in risk communication. And so as we go next to risk communication, I want you to think of this particular diagram where partially you have to manage the outrage and partially you have to advocate for safety. And this is something that I've really learned in our work with Tucson Water and with Dan, is it's not just talking about the risk or the things that are fearful, but also talking about how people can keep themselves safe. So as we move into more about risk communication and health literacy, please describe in a couple of words your feelings when you heard about the Flint lead poisoning disaster. Thank you very much for these responses. And when we look at them, sadness, frustration, outrage, disappointment, yeah, that was one of mine. Corruption, scared, confused, anger, betrayed, disappointed, outrage, exhausted. And this is what the community really they experience. And then what happens is, especially when it's related back to the government, the trust of the government is eroded. And when the trust of the government is eroded, it's almost impossible to regain. Thank you very much for participating. So many of you know this, but for those of you who don't know plain language, these are the suggestions from the plainlanguage.gov website that really encourage you to use plain language. And the way that I've described it to graduate students when I've gone to their posters is, how would you talk to your grandmother? How would you talk to a fifth grader? How would you talk to someone who has questions, and the look on their faces, huh? When you use big scientific words. Almost every scientific concept can be broken down into plain language. And it's very important that plain language and plain numeracy be used in developing messages and materials. Now I'd like to ask Dan to tell us about the Water Talks project, how we came to be, and I'll take you through the slides. Dan, just let me know when you want to move on to the next slide.
Thank you, Marty. Can you hear me?
Yes.
Good morning, everybody. This project is that we started working on, Marty and I, 5 years now, really came out of our prior experience in trying to develop effective communication material and outreach. And we noticed that a lot of our effort was not being used. We would go to events and a lot of the material was discarded at the event. And we were just starting to wonder, well, why is that? We have all the information. We've made a nice brochure. We've handed it out. We've had a little bit of communication with attendees at any of these events, but yet that information is not used, or it's not being taken home, or it's not, so it's made us wonder, well, what are we missing here? So we started talking about how do we learn about how to communicate with our audience. Next slide, please. And what we learned is that people who are concerned with emerging contaminants in drinking water basically have these five questions. But if you remove the emerging contaminant specific topic, these five questions are asked about any event or any uh, exposure of any kind of risk. So if you're in a risky situation, these are the questions that you tend to ask about, who is affected, where is it, what are you doing about it, and what can I do about it? And what was interesting about this is that we as human beings have to have an action to feel more confident on how to handle a situation we may not quite understand. And so this model that we developed allows you to answer that question in a way that gives your audience some information that they can use and go home with, and be able to feel better about how they're going to make some decisions based on information that you've provided. Next slide. So this 7 steps come from actually the occupational safety world, but it still fits with communication. Safety is really focused on clarity as far as how to stay safe around equipment and around other situations. So really, these are multiple ways that you have to use to be able to reach your audience on whatever topic you would like to inform them about. And as you see, it's very not prescriptive, but it gives you a pathway on how to develop what you want to say and how to say it. Many times a conversation is a lot better than a presentation. That really conveys more of what you're really trying to do here is create the trust with your audience. That's really, it's the crux of the whole model, is how do you develop trust with your audience, that they are confident in what you're telling them, they believe you, they will take that information, they'll ingest it, and use it to address their situation. So these are the ideas that came out of this. A lot of that research that Marty talked about, we used to build this model. This was really informing ourselves of how do people really understand information, and how do we as providers of information understand the information we're trying to give, and what are we missing between us, the providers of information, and the audience. Next slide. So this is the list of purposes of risk communication, but if you look at all of these are really looking at building trust with your audience. And how do you engage with that? So you have to incorporate all these particular ideas into how you're going to create your message. And it becomes really important to understand how you're going to do this, because your ultimate goal is to inform your audience, build the trust that you have with your audience, because it's not a one-time thing. You're creating a dialogue with your audience. So you're going to have an additional conversations in the future about the event or the risk that you're talking about. And so you have to think about it more in long terms than a one-time event, because it is a conversation with your audience. It is a conversation with the community that you have to keep going and have to learn about how to do that with your audience. And that's what we did with our project. We had a targeted group of folks who were very interested in a specific contamination in site in our system. And it was a group that had been formed about 20 years ago or so. And even though there was a lot of information provided to the group over the years, we still were back to basic information that they didn't quite understand. One big question was, where does my water come from? Which you would think would be easy to answer, but it's quite complicated. And it's more than just where it comes from. Is what's the quality? Where is it? How do I get it? Those questions that become part of that answer. So you really have to think a little bit more in complex about how you're going to frame your messaging, and which is what we were doing and learning about how to use the model. Next. So many of you have probably seen this, the 7 cardinal rules, but for us, really, we were looking at probably, a few of these points really, which was number 1, 3, 4, and 7. And so these were really where we learned that that's mainly what you have to be focused on with an audience, especially if you have an audience who uh, is understanding that, or has questions, or can become combative, or may need to have more information. You really need to be in this particular mindset to be able to communicate with folks successfully and for the long term, and be able to be open and be clear, and realize that there's always going to be questions. You may not have all the answers, and that's okay. It's okay to say, I don't know. You always follow up and find the answer, because you don't always have the answer at the time. And you want to be sure that you have the right answer, not just say something that you would at the moment. Next slide. So these are the rankings based on what I believe this is from the Menti survey, right?
Yes, this is a Menti survey asking them for their perspective on what's most important in terms of risk communication rules. So those are the 7 rules. Now, which do you think are most important, and you can rank them differently? So I'm going to close the voting. I think we got some consensus going here. What do you think, Dan? What's your response to this? It's.
What's interesting is, as the answers were coming in, it was all going on the side of being more involved with your audience, having their participation, as you can see by the answers, more of purpose versus process. So I think those are 2 distinct things you have to keep in mind. Is there's a process of how you do it, but you really have to develop the purpose of what you want to do and how you want to do it. And that comes with engaging with your audience. You have to have them participate. They will help you actually develop the messaging you need, because they'll tell you what they're looking for. And you, as the provider, probably have all that information already, but they then will be able to sort of guide you on what they need as far as information. It makes it, in a way, a little bit easier for you to develop the messaging by engaging with them. So it's really interesting that the responses are focused in that manner toward the audience, which is what we want to do with the model. The audience is key to developing your messaging, successful messaging. Next slide, please. So what we did over the last 3 years or so, it was conduct focus groups, analyze a lot of information, and develop some test materials, and eventually developed the protocol. But the whole idea here is we went out and did not an investigation, if you will, but more of educating ourselves of what the audiences wanted to learn, how they wanted to learn it, what information was important to them. And this helped us develop the different steps in the model on how we would actually approach this. So one of the things you need to do is we recommend is learn about your audience, ask them, conduct some surveys, some focus groups, learn what they want to know, then develop your messaging. This helps you be more successful in how you're going to engage with your audience, and also create that long-term trust that you're trying to develop because of these long-term risks that we're facing that need to be discussed, but in a way that's informative and in a way where you keep your audience engaged over the long term. So this really speaks to the protocol that we developed, but the whole point of this, ask your audience, use different tools to do that, because then you will be more successful in your program. Next slide, please.
So now we're going to pass it on to Ben. I want to go back just for a second and talk about the focus groups. We did it with different age groups, and we've been doing focus groups since we were part of the Hope Partnership in the early 2000s. And we've continued and find it to be effective in getting feedback and making our materials better. So Ben, take it away.
I was on mute. My job is to kind of go over the process and protocol that we showed you at the beginning and kind of how to use it using the 9 principles of risk communication that we found. And while we made this in the context of environmental health and water quality, a lot of these principles can be used without any, throughout all your risk communication. So next slide. And so here are the 9 principles of risk and safety communication. They're divided up into 3 parts: process components, content related, testing. And as Dan was saying, that very first one is probably the most important one, is building trust to really get your message across. Trust is really important, and also understanding where you fall in that trust level. Does the audience you're speaking to trust you, and being aware of that and having that inform the way you develop your materials and your communication. And then making sure you're preparing for that specific audience. The way you communicate to some audiences may be different than others, and considering age, demographics, historical trauma, things like that. And then in terms of creating your materials, there are some more here, but understanding what is the actual risk of what you're communicating versus what does the audience perceive as the risk, and addressing those. Perceived risk is real risk to your audience, so making sure you address those things. And then towards the bottom, testing and improving your messages, making sure you can find ways to see if the way you're communicating is working, and if it's not, how can you improve that? And we can go on to the next slide. And so here's that model again, and I'll go through each of these, and it's kind of broken up into different parts. And you can see the first, 3 questions is answering, the 5 questions we said earlier. What is the risk? Who is it affecting? What is being done about it? What can you do about it? And then going into, once you have those questions, identifying the audience, where you're going to communicate, when you're going to communicate, and then actually communicating, and then evaluating, revising, and then doing it again. So next slide. So that first one was, why are you communicating? What is your purpose? Is this ongoing communication, just regular communication with your audience? Is there a new law or new rule? Is there a new current event that's happening? Are there misperceptions going around in the media, and you're trying to clarify those? And so understanding why you're communicating is important, and using that to develop your materials. And then when answering that question, one of the questions is, how can you protect yourself? It's important that you have that answer giving an action item what can your audience do? Not just telling them about a risk, but what are ways to lessen that risk? And then the next one was determining your audience. So there's a lot of factors that might go into this. So it might be the age of the group you're talking to, socioeconomic level, their language, or any cultural considerations. Things that we deal with are past history with environmental hazards when we were creating this model. So the group, the community that was affected by water contamination in the past, making sure you understand that their level of risk or their risk perception might be different than talking to other areas of the community that didn't experience that trauma, and understanding your audience, and that will inform the way you communicate. Next slide. And then knowing that audience helps you understand where to communicate. So depending on age, is social media the best option? Are sending out information in the mail the best option? Another example would be with this community that we work with that has experienced water contamination in the past. We found that meeting in person, when it's safe to do so, is the best way to do it. And that kind of speaks to building that trust. So sometimes a community meeting is a great way to communicate information. And when do you communicate that risk? So, or your information. It should, in best practice, be ongoing. You should always be communicating with your audience. And then when a crisis occurs, you already have that connection, but you should always do your best to communicate whenever possible, during the crisis, after the crisis, and then ongoing after the crisis, especially if it's a chronic situation. And then if using images, I highly recommend using images, as long as it's appropriate and matches what you're talking about. And then again, once you're implementing, test the materials. And so you may want to run it by some experts you may work with, someone in that research field, to ensure that information is accurate. And then if time and budget allow, maybe running focus groups or surveys with the materials before sending it out or after sending it out as well. And then again, implement the campaign and then evaluate as needed, and then revise and continue communicating. Don't just stop.
So could I make a comment?
Sure.
There's a difference between individual materials and a campaign. A campaign would be something that included multiple types of materials and multiple audiences, so that you make sure that you're reaching everyone. Thank you, Ben. Okay.
And so we developed a training module for this protocol to work on developing your risk communication materials or campaign. This is a link to it, and we'll share it with you. And if we have time, we might share the website. But on the next slide, this is just a little bit about the module. It's a self-paced, on your own, online training module. We tested it with university students. It's developed with university students. It takes about 2 to 3 hours to complete. It's on Google Classroom, so you would need a Gmail account to take it. And then throughout it is information material, as well as self-assessments to make sure that you're getting the right information. And then on the next slide is just a description of the modules that we have. Introduction, going over what the basics of risk communication and perception are, understanding environmental health literacy in plain language, and then working to create your materials. And so this is open, and if you're interested in taking this module, you can get into contact with me, which is on the next slide, I think, and send me your Gmail account, and I can add you to the training module. And I think that's all I have, and I think we can open it up to questions at this time. So,
Okay, sounds good. We have a couple of questions. One of the first questions I see, it's Marty mentioned that people need to understand that research takes a long time. do you think that maybe people do understand that, and that people who are hesitant to get the COVID-19 vaccine think that not enough research has been done?
I can answer it, then I'd like Ben and Dan to chime in if they have anything different. I'm sure that some people do understand, and some people just, I've seen press things in the media where people are complaining that not enough research has been done. And I think we will be researching COVID for many years to come, just like we research the flu vaccine or SARS or other infectious diseases. And we may, there's a lot of question about the etiology, where it came from, how it, there was definitely questions about how it transmits. There's bound to be more questions about the Delta variant. So I think that, yes, that people may understand it takes a long time, but they may not always understand how to use the best information available to them. Ben or Dan, do you have anything else you'd like to say?
Yeah, I can just add a little bit. Just this speaks a little bit to the risk perception idea and understanding, your audience, and if that, if someone feels that there's not enough research done on the COVID vaccine and that's their reason, and so that's their perceived risk. And so part of risk communication, part of the point is to provide the information that you have available so that individuals can make their own decision to the best of their ability. And so that's my comment on that question.
I would just say quickly that people do understand research, that it does take a long time, but they may not understand what the research is about, or they may have a different understanding of what research is, that once, for instance, that once you study something, you know the answer. And research doesn't work that way. You learn more as you study the problem, and that's when information changes. So that's where it becomes a challenge to provide that ever evolving information on something, as we've seen with COVID, because research is ongoing. It takes a while, but the information that you gain from doing research can change over time. And that's something to consider as you're developing your messaging.
Thank you.
Thank you. The next question I have is for Marty. How would you personally rank the communication skills? For example, would you put clarity and concision first? And what's your rationale based on your own experiences?
Nice question. I think all of us might be able to answer that one. I actually rank listening first, because once I actually know what a person is wondering about, then I'm better able to answer the question. And then clarity and concision comes next. Clarity is clearly very important to this whole entire audience. Concision, I think, is underrated. If we are concise and stop and give a breath to what we've just said, then we can listen again to the question. Did we actually answer the person's question? And I think that that is essential to communication. Communication implies give and take. And so first listening, then be concise, and then continue to listen would be my answer to that. But I don't know what Ben and Dan would say.
It's a little tough, but I do think listening, and I would almost put empathy too, depending on the situation. Empathy helps with building trust as well. And then clarity are kind of my top three.
I would just add to that, feedback is very important. So listen to the audience when they provide you feedback, because that really is a really rich in information about what they want to know, how they know it, who they trust. Those are all in that conversation that you have. So feedback is really good to incorporate as you're listening, not just listen, but listen to what they have to say and make sure that you understand what they have to say. Uh, that's just my comment.
Thank you. We're actually right at the top of the hour. We'll take one more question and then we'll end the webinar. All the other questions, what we could do is the speakers will respond to them and we'll post the responses on the discussion list in the Health Literacy Solutions Center. So the last question that we'll take live is, let me see. How do you avoid overstating the risk and perhaps creating doubt and losing credibility?
I think you have to go back and look at the whole model to be able to do that. It's and go back to chunking the information up into smaller bits by listening to what the real question is, giving a little bit of an answer, and then listening again. But if you don't have the option of having a listening opportunity, then you have to have that question in your head, and you have to think about what are the steps in answering the question about the actual risk. And what I see happening that I think actually works against us is giving all the information at one time. So stating that, for example, people with immune deficiency should take a booster shot. Or saying that only people with immune deficiency needs to take a booster shot, but then going on and talking about who it is that has to take the booster shot. I call it scaffold information. We use it in education a lot, where we say one thing and then we add another thing, and then we might have more complex information even on a website or in pamphlets that are underneath the table, so to speak, that we can add to someone's repertoire.
Yeah, and I can add to that too. In terms of losing credibility, make sure that you're using, credible sources in your communication. But another key component is answering that question of how do you protect yourself and giving an action item. So being honest about what the risk is, but making sure you provide steps that they can take, or assurances that there are steps being taken by appropriate entities to lessen that risk or fix that risk. So it's important to be honest, but add those action items.
Wonderful. Thank you so much for answering the excellent questions. Can we move on to the next slide, please? After this webinar, by the end of the week, you will receive an email containing a link to a brief online evaluation. And as I mentioned earlier, if you are requesting CEUs, please make sure you fill out this eval in order for you to receive your certificate. The recording and the slides will be made available also by the end of the week at the Health Literacy Solutions Center.org under the webinar archives. If you want to register for upcoming webinars, we will also have that up there. Again, I want to thank you again to our speakers for a wonderful presentation. I want to thank everyone who joined us today. Stay safe and have a good day.